Good evening, everyone. The open meeting law requires that I notify the public that this meeting is being recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made and broadcast by Boston City TV, which is a part of the City of Boston Office of Cable Communications. And now we hand it over to Jerry.
Hi, thank you, Jessica. We're convening this monthly meeting of the Disability Commission Advisory Board. And as a way to kick things off, we'll start with introductions. My name is Jerry Boyd. I'm the chair of the advisory board, and I'm from West Roxbury. And who else would like to introduce themselves?
I'm Paul Karen from Boston, Massachusetts. I work at the Boston Planning and Development Agency, and I'm on the advisory board.
I'm Elizabeth Dienklauer. I'm the vice chair, and I come from Back Bay.
I'm Ducia Lebowska, Ducia Alpha Short, and I'm on the board, Disability Commission and the board member, and I'm in Mission Hill, specifically Boston.
I'm Carl Richardson. I live in Brighton Center, and I'm an advisory board member.
And Kyle?
Kyle Robu. I live in Lower Roxbury and also on the commission's board.
Any other commission members that we're missing?
I don't believe so, Jerry, not at this time.
Great. Okay, next on the agenda would have been the approval of the May minutes. However, they're not ready yet, so we'll have lots of approving to do next month. So we'll get right into the presentation for this evening. It's on the reopening, specifically plans for outdoor seating at restaurants and how they would impact accessibility and folks with disabilities. And we have the Chief of Streets, Chris Osgood.
Jerry, thank you so much for that introduction. So again, Chris Osgood. I have the great pleasure of working with Commissioner McCosh, Jessica Sarah, with Patricia, with the entire team. And I work specifically on the Public Works and Transportation teams here in City Hall. And delighted to give you an update about what we're doing specifically around restaurants and outdoor dining as part of the reopening process. But Carl, to your point, I'm happy to talk about any other sort of transportation or public works issues that come up, and I can also just give a quick update about the MBTA's reopening process or where they are and what should be expected if that's helpful. So first on restaurants, I wanted to sort of talk just briefly about sort of why we have an intentional focus on restaurants within the city, where we are in the reopening process, and some of the work that's happening across a wide variety of departments in the city to support their healthy reopening. So first, why the focus on restaurants? It's a critical sector for Boston. The overall food service and restaurant industry employs around 51,000 people in the city. It's around 7.9% of the entire employment of the city of Boston. It's a significant portion of the city's sort of overall GDP. It's a significant portion of what I feel like can help bring that sort of neighborhood vitality to every place that all of us call home. It also employs a high percentage of our residents who make lower income. So the vitality, the restoration of this industry is particularly important for some of those who are most economically at risk during the course of this pandemic. It's also been an industry which obviously has been very significantly impacted by the COVID-19 pandemic. We saw a very high percentage of employees in this sector file for unemployment insurance as of the end of May. I think it was the second highest sector of any sector that we saw for filing for unemployment insurance. So one that obviously was experiencing a obviously very significant change in employment. So one that we want to make sure is having a reopening, but a reopening that is healthy in the city. So just think a little bit about this industry and where we are in the phased reopening. On May 18th, Governor Baker released the phases for reopening for the Commonwealth of Massachusetts. That first phase, phase one, started on May 18th. The second phase, phase 2, started on June 8th. So during phase 1, there was actually no change for restaurants. Restaurants were not allowed to provide any table service at that time. They were focused solely on delivery and on curbside pickup. One of the things that we did as a city team was we expanded the amount of temporary curbside pickup that was available. We sort of helped. I think the final count was somewhere between 75 and 100 restaurants established new sort of pickup zones at the curbside to be able to facilitate and support those businesses and help more of our residents simply get access to those restaurants and the meals that they provide. On June 8th, though, phase 2 started, and with the start of phase 2, what the state calls phase 2, step 1, was allowing for outdoor dining to happen in the Commonwealth of Massachusetts. At some point, and we expect it to be next week, phase 2, step 2 will start, which is when there'll be both outdoor dining and indoor dining. But to be able to support outdoor dining and even to be able to support dining in general, as we get to the further milestones of the phased reopening, we knew that for a healthy reopening, one that allowed for social distancing for patrons, that as they came to a restaurant, that sort of outdoor dining would be important. So we created an effort, a real cross-departmental, citywide effort, many players. The commissioner's team, inspectional services, huge leadership by the Boston Licensing Board, the economic development team, public works, transportation, a huge cross-departmental collaboration to think about how we support outdoor dining and do it in a way that is that supports businesses, but does so in a way that ensures accessibility and ensures safety throughout that process. As part of that, what we basically made available or are making available is a chance for people to be able to expand outdoor dining into the sidewalk, into private spaces. So think adjacent privately owned parking lots, or even into certain parking spaces that are adjacent to restaurants. We had about, I think as of this past weekend, nearly 500 restaurants expressed interest in this program. Over 300 of them had actually submitted applications to be able to participate in this program. And over 200 had actually been approved for some form of outdoor dining. So again, whether that is private space, the adjacent parking lots, some sidewalk space, or some parking spaces. In order to be approved, a restaurant, though, had to make sure that it was not, in terms of on the roadbed, wasn't in a place that was a bus lane, a designated handicap parking spot, a bike lane, a bike share space, a place that was otherwise obviously prioritized for other uses. Similarly, if they were approved for sidewalk space, that sidewalk space couldn't sort of restrict the appropriate and accessible path of travel for that sidewalk. As part of this effort and to ensure that spaces we were creating in the public right of way were accessible, with great credit to the commissioner and her team, the commissioner applied for waivers from the AAB at the sort of middle of May, which were granted to allow us to be able to use portable ramps to ensure that the spaces that we were creating sort of in existing parking spaces, spaces for dining that we were creating within existing parking spaces could be accessed by a portable ramp or a temporary ramp built out of asphalt. We were granted that waiver, and again, with credit to the commissioner and some work we're doing within Public Works, we're actually going to be providing ramps to make sure that that restaurants, as they open up, are creating spaces that are accessible within the city. We are in the early days of this program. Spaces are slowly opening up, and there's work, and with great credit to the licensing board in particular, work that we are doing to make sure that they are conforming to all of the requirements, and that the spaces that are being created are ones that really work for all of us and all the patrons of the restaurants. We do expect that as we go through these phase reopenings or phase reopening in general, that we want to sort of monitor how this program is working to adjust it. Every restaurant has been told multiple times throughout the process what we are doing is not precedent setting, and it is also subject to change. So if there are things that we are seeing in how this program is being rolled out that need to be adjusted, there's been a lot of conversation and will be ongoing conversation to see how it can be adjusted. Those were some of the principal points on the restaurant side. Happy to take feedback, happy to take questions, and those that I can't answer or the commissioner can answer or can answer, I'll happily sort of get back to you on those and really see this as kind of just a moment in the conversation about this. Again, the program is one which is designed to sort of be a learning program, and we want to make sure it's being tailored and adjusted over time to really work for all the stakeholders. So maybe I'll pause there. Again, happy to take questions and comments, and then we can talk transit, MBTA, other transportation issues after we talk about restaurants.
Hi, this is Paul on the phone. I have a question for you, Commissioner.
Yep, please, Paul. Yep.
I'm just curious about the opening of Charles Street and Beacon Hill for outside dining. I noticed Hanover Street already started up, and some of the business owners in my area have mentioned to me asking if they can have the same permission to open up.
Yep. So great question, Paul. So we have gotten the Business Association of Charles Street, which is not their official name. I'm blanking on the official, embarrassingly, I'm blanking on the official name of the Business Consortium for Charles Street, as well as the Beacon Hill Civic Association have reached out to us with a plan for Charles Street. And we are working through that right now. As we work through kind of the broader plan for Charles Street, we also, though, are, that doesn't sort of hold back sort of working with specific restaurateurs on the street to sort of permit spaces. On Charles Street, I think without exception, they will be looking at parking spaces and not sidewalk space because there simply, I don't think, is the sufficient sidewalk space on Charles Street. But I could be off on that. Anyway, long-winded way of saying we are working through both the specific restaurant on Charles Street as well as the full extent. And just in context for Paul's question, on Hanover Street, there were a large number of restaurants, obviously, that applied for outdoor dining. And so we did a larger redraft of the curb rules on Hanover Street to think about how sort of collectively we are stringing together a set of these outdoor dining experiences in a way that is more coordinated, again, because of the density of restaurants on that street.
Okay, thank you very much. I know that Mayor Walsh and City Councilor Kenzie Bach have been a big help with this.
Yep. So obviously this has been a big priority for the mayor, a safe reopening in general. And again, the focus here, well, we want to make sure that that reopening and that return of our economy is happening. I'd be remiss not to underscore the only way that happens, or the best way that happens, is for us not to forget the public health guidance that we need to keep sort of first and foremost in our mind as we do this.
Thank you very much.
Yep, of course. Jerry, you might be on mute.
Does anybody else from the board have a question?
This is Carl.
Go ahead, Carol.
What is the procedure if we see restaurants blocking past the backstep for people with disabilities? Is there a place to call or? So
there are two things that I would request you do. One is we've set up a specific case type within 311, the city's 24-hour hotline. So if you call 311 and you have any form of a complaint or comment about this program, that gets immediately to the team. So whether that is blocking access on a sidewalk, tables too close together, any other issue associated with this program, call 311. We've created that case type for exactly this purpose. And the licensing board in particular has sort of an enforcement arm that can address this. By all means, feel free to let me know as well. And I imagine I speak for the commissioner, that it's helpful. It's helpful also to sort of make sure that that's flagged for us. But 311 is a great way to be able to get it to the entire team.
Okay, thank you.
Great. And I know, Ducia, you had a question? Oh, you're on mute.
How about now?
There you go, yep.
Okay, good. Sorry about that. Yeah, thank you, Chris Osgood. By the way, this is Ducia. I'm just curious. You were talking about the restaurants that are opening up and who are the applications to expand their business for outdoor seating. My question is, this may be obvious, but is there like going to be a list, for example, is there going to be a list of somewhere where that people can access so they can see, okay, these restaurants I can go to because they have outside dining, and I mean, of course you can Google it, of course, but some people just want specific restaurants, and
Yep.
if one of there's like a list or something. Thank
That
you.
is a great question. That's a great question. And I know that we have the list. I know that we have various variations of the list. And we were going to post one on boston.gov. I don't know whether we have done that yet. Other folks might know the answer. Jessica, maybe I'll loop back to you, get the link to you if and when it is up, so that you see that. we
Chief,
can-
I know it is up there. I've seen it.
Commissioner, do you know if it's up already?
It is up. I've seen it.
Okay.
On boston.gov?
Yeah, we can
Yes.
send out the link after the meeting.
Great. Great. And Elizabeth, I know you had a question.
Hi, thank you. I had a question that, given the combination that some restaurants that prior to this weren't necessarily, without it being in the street, didn't really have the capacity for outdoor dining, that in combination, depending on that, even when we enter phase 3 and indoor dining is a potential, becomes a part of the equation, but at reduced seating. Is there an anticipation? Is there a timetable for how long we might expect this? In other words, will some restaurants that have this current access continue to have it or request it when indoor dining is an option? Given I recognize that they've had economic declines, but just so our community has a sense of timetable.
Yep, a great question. So it is currently up through, our anticipation is for the season. So even when indoor dining is allowed, we would expect the outdoor dining to continue, or have the right for restaurants to be able to continue the outdoor dining to the extent that they are interested in doing it sort of into the fall. With essentially this program sunsetting at the end of this calendar year. And then I think we'll want to take some time to revisit lessons learned, to think about what next year might look like. Everything which we are doing this year does not translate beyond sort of this season and this moment, but they will have the right sort of through the summer and into the fall to be able to continue to do this.
Thank you.
Sure. Thanks for that. And Chief, I had a question for you. This is Jerry. In terms of, I know you said the program's new, things have just started, but I've seen some pictures in the paper. Hanover Street looked a little crowded on the Globe the other day. Have you gotten any feedback so far?
Yeah.
And how's it going? Are there any concerns about people not social distancing or being able to social distance?
It is a great question, and I think and an important thing to again focus on. Like we have done open streets efforts in the past where we've sort of encouraged sort of the use of our streets in a different way, which has been much more about, hey, everybody come down and check out Charles Street or Newbury Street. That is not the intent of this program. To your point, Jerry, the intent of this is really to help restaurants safely reopen. So while we encourage people to sort of to dine at restaurants, we don't want to lose sight of that. First and foremost, social distancing is critical. We're still in the midst of reopening safely from a pandemic, and we can't lose sight of that. So we're trying to find that right balance of opening up opportunities for outdoor dining that support a really critical portion of our economy and part of what makes our city sort of a vibrant place. But again, to your point, Jerry, like we want to make sure that's done in a way that has health as sort of the top priority right now.
Sure, so to piggyback on that, will the city or inspectional services, will they be doing some checking once the
Yep.
program gets really up and running, or how will that go on?
Yep, so the licensing board has already been out there. They have a set of inspectors, and one of the principal things is around that 6 feet of distance between tables, and enforcing sort of the principal public health requirements that are part of this program, because that's critical. And what we've heard from the restaurants is that it's, for them, reopening is important, but reopening only to close later is actually is a significant problem. So that it is far better to be cautious in our reopening than it is to have to close down or have to sort of backslide in the reopening phasing. And so they're very mindful of that as well. And I think anyway, there's a lot of additional work. Again, we're early in this process, but some additional work we need to do to make sure that this reopening is progressing in a way that fits with the public health guidance.
Sure.
I had a question. Can you hear me? My mic was kind of acting up.
Perfectly. Yep.
Chief, can you talk a little bit about what other streets are closed as far as whole streets, and if they're open at all to traffic, and what the barrier situation is like for restaurants?
Yep. So in some places where either because of the design of the street or in some ways the utility of the street from a transportation sort of a need at this moment, we are actually closing streets. There are very few of these. We are looking at sort of 6 to 10 right now. That would be closed. And when we think about closing the streets, there would be no change in barriers or access on the sidewalks. It would be really about having vehicular traffic sort of for that block be closed, not for emergency vehicles and not for loading vehicles. And so to use an example, which is literally right outside this building, Union Street, which is essentially one long block opposite or near Boston City Hall. That street has been temporarily closed. It has 2 police sawhorses essentially at the mouth of the street. And then within that is the cafe zone. Similarly, Union Park in the south end, 1 block of Union Park in the south end between Tremont Street and Montgomery Street. So a stretch of roadbed that's probably maybe 40 to 50 feet long in total. That is also has been or will shortly be closed. Same barrier treatment with sort of sawhorses or in some cases water-filled jersey barriers that are in the roadbed itself, but still allowing sort of access sort of at the entrances of both blocks for pickup drop-off or for any other uses. And we're looking at, we're sort of walking through the process there is it's based on sort of review by police, fire, and EMS, review by the transportation department, and sort of based upon requests as well from restaurants. So where what restaurants have requested and where it sort of meets our needs from an access and emergency access perspective, we're willing to entertain street closures.
Great.
Commissioner, does that answer the question?
Yeah, it does. Thank you. And I had a few things to talk about the work that we're doing before we move on to the T, but I don't want to stop anyone else from asking questions.
Any other questions from the advisory board? And I didn't know whether anybody was on from the public, Jessica, on the meeting. Do we know if any member of the public's joined?
I think we've had a couple people hop on and 1 or 2 stay and hop off. So I think if you just open it up at the end to see if the public wants to make a comment.
Sure. Any other questions from the advisory board before we do that? Any questions for regarding the restaurant reopening and sidewalk dining from the public? Hearing or seeing none, I guess we could move, if you did have a few minutes, Chief, to give us an update on the City and the T, that'd be great.
Gladly. And Commissioner, do you want to talk about any of the work which your team is leading and that you're leading before I do?
Yep, just a few things about the sidewalk and the accessibility of the restaurants. So my staff, my architectural access staff, Sarah and Patricia, they're doing a really good job reviewing the plans for anyone who requests seating on the sidewalk. They're looking at sidewalk width. So the sidewalks will be required to have 5 feet when it's a regular, typical sidewalk, 5 feet clear. And if it's a wider sidewalk, like a Boylston Street or something, they're requiring 8 feet clear. So the city is very, very definite in that they're not going to compromise the width of the sidewalk. So you can be confident in that. And if you see any situations that look like that, please, reach out to us or call 311. I'd probably recommend that you do both, just so we can have a heads up, but then also log your complaint to 311, just so it has a ticket number and it's like an official complaint. So we're paying a lot of attention to sidewalk widths, just so everybody can be reassured. And like the chief said, the AAB requires an accessible path of travel from the restaurant itself to the seating area. So we're working to get the access ramps out. I've already seen a few deployed, so it's really good news. And let us know if you use one, how it works. I'd love to get your feedback, because we want to make sure this is working for everybody. We understand that it's not precedent setting. It was kind of thrust upon everybody. We're moving quickly and we're all trying to do our best, so we would appreciate the feedback. And then the final thing I want to say is that my team is also working on putting together what we're calling an accessibility package to go along with the ramps. And that's going to have a sign with the international symbol of access, the wheelchair symbol, that says a ramp is available upon request. And we're also going to do a one-pager for the restaurants on how to set up the ramp, interacting with people who have disabilities, and etiquette, just something really quick and simple, just so that we support the restaurant owners during this time, because we know they've been up against it. It's been a brutal time economically, and so we feel like if we pay for the ramps and we help them with signage, it'll be things that we know get done, and it will also be a help to the business owners. So appreciate any feedback. If you see the signage, if you use the ramps, talk to us about sidewalks, and spread the word in your communities too that we're doing all this work. So we'll send you the link to the restaurants that are open after the meeting.
I just had a quick question, Chief. In terms of, I haven't availed myself of the outdoor dining. What does it mean in terms of access to restrooms and stuff like that? How is that looking? In this kind of new normal and social distancing? Are public restrooms still open? Are they required to be open?
Within restaurants or public restrooms in general?
Within restaurants specifically, but public restrooms in general, sure.
It's a great question, and I should know the answer, and I don't. Let me see if I can, unless Commissioner, or Jessica, or Patricia, or Sarah, you guys know. Otherwise, I can move back to you on that.
I only know anecdotally. We went out to brunch on Sunday, and I heard the waitress saying that you can only go inside if you want to use the restroom. So it was open at this one particular location, but I don't know. And as far as public restrooms, I was down at Castle Island last week, and the public restrooms were open. So again, I don't know if that's anecdotal, but I've seen them open.
Okay, great. Thanks. And now, if you have a few minutes to talk about the City and the T, that'd be great.
Sure. So just I can give a quick update on the MBTA, and with credit to them and their work on this, there will be some significant increases in service levels, getting close to back to normal come Monday. So just to sort of tick through their major services, the subway will be basically back up at normal service levels, more or less, come Monday. This will be essentially across all lines. Current ridership on the subway is significantly down. It's at about 13%, I believe. And it has been operating on what's called a Saturday service schedule, which is roughly sort of half as frequent or half as many trips as normally occur. And so again, Monday, you'll be back to roughly normal service levels on the subway. You'll also see, for anybody who's uses the commuter rail will be back up at roughly 85% of the trips. Not all the trips will be back, but many of the trips will be back as part of the reopening. The ride will continue at sort of full service, but for no shared rides, it'll only be sort of per person rides. And then the bus service, which is actually back at 30% ridership, so has seen the most ridership or the highest relative ridership to its baseline levels, will be also restored significantly come Monday. This is a little bit wonky, but essentially it will be for 80% of the routes. So the vast majority of the routes will be back at 70% of the frequency, with the ability to provide additional sort of run as directed bus trips on some of the highest frequency routes. So the number 1 bus, the 28 bus, the 111 bus, some of those buses that are most frequently used in our city and across the region will see even higher service levels. So that should all be coming into play on Monday. One of the things which the city is doing in coordination with the MBTA is trying to figure out how do we make sure that as people queue for buses, that there's enough space so that they can be appropriate social distancing. This can be particularly tough where you've got bus stops that are right next to big transit stations. So think like the Heinz Convention Center, the number 1 bus, or the Broadway T-stop and the buses that serve that. So we are redesigned around 15 MBTA bus stops so far, where we have the highest number that have the highest utilization, to sort of think about how we can create some greater opportunities for social distancing as people queue for the buses. And then we're also working with the MBTA on some additional dedicated bus lanes in our city, both permanent ones as well as pop-up ones, to think about how we can ensure that for people who are on buses, that they are not stuck in traffic. This is incredibly important as we think about and essentially increasing the frequency and the comfort of riding buses. Similar to Jerry, your question about restaurants, the T is being very mindful of how many people are on the bus or on the subway or on the commuter rail. The T is limited about how many buses they have or how many train cars they have. So one of the best ways we can essentially expand the capacity of the T is to make sure things like buses aren't stuck in traffic and that they are moving as efficiently as possible, so that people can have as comfortable as safe from a public health perspective a trip as possible on the MBTA. So we're coordinating with the T on that work as well. One of the things that is really helpful to us, if there are routes, if there are locations, if there are places that or T services that you would want the city to be advocating for on your behalf with the MBTA, we're happy to do that. So happy to take any thoughts, feedback, comments, requests, either now or later on that, and see how we can work together as we help public transit come back for our city.
Chief, that's a great point you made about trying to limit the number of folks queuing up at bus stops and whatnot, because I live closest to Forest Hills, and I actually took a bus this weekend, and I didn't even think about the number of people. It looked like a pretty desolate, Forest Hills at the time looked pretty desolate, but I didn't even really think about, like, well, what if it's during the week? What if it's rush hour time or whatever? There could be a lot of people waiting at this bus stop. I hadn't even thought about that. So that's a very good point.
Thinking of Forest Hills, and we are going through the public process right now. As folks may know, we created a dedicated inbound bus lane between Rosendale Village and Forest Hills. Gosh, maybe 2 years ago now. We're going through a public process and getting community feedback on what an outbound lane would look like during the afternoon. So, Jerry, to the extent that would be, you have thoughts on that? Others, if you have thoughts on that, we are looking for feedback, and we'll likely pilot something in that respect, going southbound, outbound in the afternoons later this year.
I was fortunate to be part of a public meeting with the general manager last week, and he said that he said that their goal on buses, for example, would be to have no more than 20 people on them.
Correct. Yeah.
At one time, and I asked him, so does that mean you would deny someone service if they were like the 21st person? And he said no. He's like, but that would be our goal, is to have buses with only 20 people. We wouldn't deny service, of course, but he's like, that would be our goal, is to have significantly reduced numbers of people on the buses. So.
They are going to, as Jerry, I'm sure you heard, the T is going to try to do a significant amount of sort of public communication about where they're experiencing trips that are at or near their public health capacity. Typical bus capacity is around 56, as Jerry said. They're putting 20 as their sort of recommended capacity. I'm sure they have a better way of phrasing it than I just phrased it, but with the idea of then communicating to people when they are experiencing sort of high capacity trips, for those who can potentially shift when they are traveling, so that they can shift when they are traveling or what route they are choosing, recognizing that there are some people for whom that isn't going to be a possibility.
I know Elizabeth had a question.
Yes, hi. So similar question about when people are riding the T, and you said there'd be a reduced number of cars available. What, like a per car capacity on a T? What is the thinking there?
Yep. So similar to the bus, and I don't remember off the top of my head. And Jerry, you might remember, they do have a similar sort of threshold based upon a car type that they are looking for their new definition of what capacity is. And I can loop back to you and provide that. For buses, again, it's 20. For the subway cars, it is more because they're
percentage or that kind of thing.
They're using a standard of, gosh, I think it may be, anyway, they have a certain per foot per passenger spacing that they're using for their definition. And I can loop back to you on that.
Great.
Jessica, I can get you, or Commissioner, I can get you the content and get that out.
And Jerry, could I just ask a follow-up?
Oh, please.
Oh, thanks. And so there, and follow-up, when you were saying about public communication, so in real time, if it seems like people are congregating at a given T stop or a given bus stop, in real time, they'd try to activate more buses, or just the next day?
So they do have, I think, some near real-time flexibility. What they call run as directed. It is where they can basically assign additional buses to a route. I don't think, though, it may not be as sort of like demand responsive as sort of knowing that, hey, in this hour we've had a challenge, but they are going to, as I understand it, look at where they're experiencing crowding, and also, to your point, Elizabeth, where they've experienced some crowding in previous days, that they should just, as a default, add some baseline additional capacity. And again, the routes that they're looking at are ones which are likely the ones they've already defined as the key bus routes. These are, like, again, the 39, the number 1, the 28, the 22. These are sort of like some of the most heavily traveled bus routes in the region, and likely the ones which they'll just add some additional service as a default on from the start.
Any other questions for the chief from the board?
I had a question that I wanted to just ask.
Go ahead, Commissioner.
So Chief, I heard from one resident, I haven't taken the bus since the changes went into place, but I guess wheelchairs need to board in the front, but I guess now they're doing rear loading for passengers. And the resident I heard from, she uses a cane, and she asked to get in the front way, and the driver wouldn't let her because it was close to the curb. So he said, oh, you can make it here. And she said, well, I probably can, but I don't know when you stop. I don't know if I'll be able to get off.
I have a...
So, yeah, I don't know what the protocol is.
That's not supposed to happen. They're not supposed to deny anybody who said they need to use the front. They're not supposed to be denied. So SWA, system-wide accessibility, would want to know about that. So I would direct the constituent to contact, file a complaint if they're comfortable with that, or give the information to you, Commissioner, and you can forward it either to me or we can file, we can
Okay.
follow with SWA for them.
And is that gonna remain in place, the rear loading? Do we
I
know?
don't know that.
They are going to switch back from rear loading to both doors. I don't have the timeline on that, but that will happen.
Any other questions from the board?
I have one additional one, Jerry.
Go ahead, Elizabeth.
Okay, thanks. So on the ride, they have, a notice that goes out that says about wearing masks, except if people have a medical condition. As more people begin riding the bus and the T, how will that aspect of masking be handled? Or if someone's not wearing a mask, which might be for a valid reason, a medical reason, but how is that part going to be handled?
And Jerry, you may know, feel free to correct me on this, or others feel free to correct me on this. Essentially, while the T does, in keeping with sort of the state guidance, request that people wear masks, they're not going to deny service to somebody who is not wearing a mask. And I don't think are asking whether that's for medical reasons or other reasons. Their request, though, again, in keeping with state guidance, is that people do have without denying service for those who don't.
Yeah, all the communication I've seen is exactly that, Chief, that they would strongly encourage folks to wear face coverings, but they cannot deny and will not deny service to anyone who cannot or is not wearing a face covering. So.
Yeah, I actually had a meeting with Laura Brailsford, who's the head of system-wide access, and I asked her about that because I'm putting together for Mayor Walsh some guidance on mask wearing for people with disabilities, because right in the state guidelines, it exempts people with disabilities, people with breathing problems. So Laura said that it's the same thing, like they're just gonna handle it on a case-by-case basis. They can ask people to wear a mask, but they can't ask why they're not wearing one. And that's the guidance I'm putting together for city staff, because people may come in City Hall and they may not be wearing a mask either. So I also was researching some best practices, and things that the public can do is just, try to sit far away from that person. Just, basically we use common sense, because we know everybody isn't gonna wear a mask, whether for a medical reason, a disability, or some people just don't wanna wear a mask. So I would say just, try to use common sense, try to, keep your distance. And, you can always call us if you have questions, if you have complaints. I'll try to get the guidance out to everybody on the board, so we'll just have it for reference.
Great. Well, thank you for your time, Chief. It's been very, very helpful, and you've been great about answering all our questions. I appreciate your time.
My pleasure. Wonderful to be with
Can I ask-
all of you.
Can I ask one more
Oh, sorry.
question?
Sure.
Do you have any information on phase 3 and the reopening time?
What will be open in phase 3?
Yeah, well,
yes.
it's open in a time frame.
So I don't have a time frame yet. And
Earliest would be the 29th, correct?
yeah, and I think here you see sort of a change in sort of general restrictions. There are some of the things that we're looking at in phase 3, some of the arts and entertainment establishments. I believe that some elements like bars are part of phase 3. There are additional things around sort of recreation that'll have impact on sort of like what's permanent or permittable in parks, or also in phase 3, sort of an expansion of sports. Anyway, I can pull together sort of a full list that mass.gov has of, if that's useful, of sort of the things that are in phase 3. Some is same businesses as phase 2, just with a different set of guidance, and some are just new businesses that haven't been allowed to open in phase 1.
Great. You don't have to look at their document. We can look it up on the web.
I can.
It's
Great.
probably mass.gov.
Yes, I will. I'll throw one thing in the chat in a moment, and then I'll follow up with you as well.
Great.
Great, thanks so much.
Of course.
Thank you, Chief.
My pleasure, Carl.
just wanted to call your attention to the chat. In the chat, I put the link for where all the restaurants that have open seating is currently. It's about halfway down the page on the link that I sent.
Great, thank you, Jessica.
No problem.
I probably would have forgotten that in my report, so thanks for reminding me.
Quite all right.
But next on the agenda, I believe, is my report, and I will try to keep try to keep it very brief. But we are living in quite a turbulent time right now, and I just wanted to I just wanted to recognize that in terms of not only in terms of COVID, and we're reopening from COVID, and people are still nervous about COVID-19, but also about, you know, the unrest in terms of the protesting going on right now in terms of Black Lives Matter and things like that. So I just wanted to say that you know, I know we as a board, you know, we want to be inclusive of everyone, regardless of race, creed, color, or disability. We want to be welcoming to everyone, and just to have that on record. And I actually also wanted to share a brief quote that I read in an article by Kareem Abdul-Jabbar recently, which I thought really crystallized some of the issues going on right now. It was an op-ed piece that he wrote in the Los Angeles Times, probably about a month or so ago now. The quote is, "Racism in America is like dust in the air. It seems invisible, even if you're choking on it, until you let the sun in. Then you see it everywhere. As long as we keep shining the light, we have a chance of cleaning it wherever it lands. But we have to stay vigilant because it's always still in the air." So again, I just wanted to recognize that I know that this is a very turbulent time for everyone, and I want everyone to know that you know, we want to be as supportive and welcoming to everyone as we can. So I don't know if anybody has anything to say or anything to add, but I just thought I'd give this time as a space to do that. So
I do.
go ahead, Elizabeth.
Jerry, thanks for stating that. I know that you also would include in that sexual identity orientation, and that we also recognize as a commission that these identities are, people can have multiple identities, you know, and that just as they, within the Black Lives Matter, that they also were marching for Black disabled lives, and then also the Black trans community. And so that just not only I know that our goal is inclusiveness across the board, but just also recognizing that for some people who are at the intersection of multiple reasons that they might have additional vulnerability or discrimination, that certain, for certain people, it's compounded by their combination of circumstances.
Yes.
Or that in a public health context or medical context, given that we know with Black, a lot of members of the Black community, that health disparities are also, this combination of what we had learned from COVID and then the two pandemics. But thank you for bringing that up in this forum.
Well, thank you, Elizabeth. And again, I don't mean to exclude any group, you know, so thank you for bringing up some groups that I did not highlight. So, but again, does anybody else have anything they'd like to share or to say? Okay, just to move on. I know the commissioner will probably talk a little bit more about this in her report, but her, along with BCIL, are sponsoring the 30th anniversary of the ADA on Wednesday, July 22nd, 2020. I know I was very excited to receive the link to get this year's T-shirt. I always enjoy displaying that proudly, and I guess we're being asked, because this year's event is virtual. We're being asked to wear our shirt and send photos along or videos along of us wearing our shirt, so that can be part of the day's celebration as well. But like I said, I'm sure the commissioner will talk more about specifics of the event during her report. And with that, I guess we will move on to the commissioner's report.
Thanks, Jerry, and thank you all for joining us tonight. Just since we're talking about ADA 30, I was going to ask Jessica to give the update because she's been doing the lion's share of the work for our office, that's for sure. She's really taken the lead on it, and she will know more about it than I will. So I'm going to throw it to Jessica.
Sure. Thanks, Commissioner. So Jerry was a great spokesperson for our ADA Day, so I'm hoping that our ADA 30 event, so I'm hoping that Jerry's one of the first ones to get a t-shirt and post a photo. That being said, the t-shirts arrive tomorrow. They're arriving at BCIL, and BCIL is helping us distribute them. And so I will put a link into the chat, and we'll also send out all these links by email as well. Oh, great. Sarah put the link in to a SurveyMonkey, which is how you fill it out, and BCIL will mail a t-shirt to you. They'll mail t-shirts to your family members too if you've got multiple people in the house that you want to get shirts for. And then also they will give you a series of 3 fill-in-the-blank signs. You pick the sign that resonates most with you. There are 3 different prompts. And then we're asking that people take selfies with them, with the space for the fill-in-the-blank filled in with your thoughts related to disability access and disability justice. And then on July 22nd, which is a Wednesday, starting at 1 p.m., we're going to have what we're referring to as a virtual rally, which is looking to be a kind of a roundtable discussion and conversation with disability advocates throughout the years. We are having Judy Heumann is going to be one of the speakers, and we are working to confirm multiple other speakers, prioritizing people of color and Black individuals with disabilities. And so we are working to kind of secure those. We've sent out invites and are looking to secure those members to come and talk about the ADA, time before the ADA, kind of the struggles that the community is facing now, and the hopes and goals for the future. Because as we all know, the ADA gave us a lot of access, but it didn't give us all access. And so there are many different ways in which disability rights still need to be in the forefront, especially when we talk about intersectionality and intersectional identities. And so we're really going to be discussing that and highlighting that on our ADA Day, on our ADA 30 event. We'll be participating via Zoom for that event, and more info and details will be sent out to the board prior to the event. I think that covers all of it, Commissioner.
Sounds good. I think just to confirm, we have CART confirmed for the event?
We have CART and ASL confirmed.
Oh, great.
We have CART. I was talking to Carl about it earlier. We have Catherine Zielinski confirmed as CART, and we have 2 CDIs who will be providing ASL interpretation.
Great.
Yep.
Thank you, Jessica. So, needless to say, we are disappointed that we can't see everybody in person, but luckily with technology, we'll be able to still connect. So, get your orders in for your t-shirts and send us your pictures as soon as you can.
Can you resend the link out for the t-shirt?
Absolutely. It's currently at the bottom of the chat, but we can email it out as well.
Yeah, I don't do well with chat. If you could just send it out to an email to the group, that would be great.
Absolutely. I'm going to send out a link to all of the stuff that we've put in the chat today.
Okay,
Either tonight or tomorrow.
got it.
Great,
Really
thank,
appreciate it.
Thanks, Jessica. 'cause
Alrighty.
I don't see it in the chat actually, so,
It might be down.
Neither do I.
yeah.
All right, so I can give my report now. Elizabeth had mentioned, protests that have been happening lately and, people coming together in big groups. And while we understand the need to do that, we do want to let people know that the coronavirus is still active. So caution people to be careful. And also to let you know that if you participated in a protest, recently the city is offering free testing. Over the next 3 days. Actually, the state is offering it, but there are some places in Boston that are also offering testing. So, feel free to get tested for that, or even if you were in a protest. The city is offering free testing, and they're not really asking questions. So, if you feel like you've been exposed or just being out in public and you're worried about it, you can find a place in Boston to get tested. And on that note, at this time of the year, it is budget season. So Mayor Walsh worked with all the departments to put together his annual budget for FY21. It kicks in July 1st. So right now he's in the process of doing battle with the city council, friendly battle, but they do it every year. The mayor will submit a battle and the city council will reject it because they want to give their input into the budget. So now it's back in the mayor's hands. And one change that he made that I wanted to let people know about is that he took $13 million out of the police overtime budget and he put it more into services for people in vulnerable populations and at risk. So he's given some of it to Age Strong, he's given some of it to Boston Center's Youth and Families, to the Mayor's Office of Immigrant Advancement. So I think it's a really good reallocation of the money because hopefully it will support people and work on prevention rather than like crime and punishment, so to speak. So just to let everybody know about that. And he's also made significant investments in other areas and increased the budget from last year. So,
Commissioner, did he allocate any to your office?
He did not. No, he didn't. But I'm not so disappointed about that because in the last few months we've received 2 grants, so we actually have a ton of money right now to do our work. So
okay,
we're good with that.
How was he able to project a budget because the state hasn't even begun to formulate their budget, which start next week? You know what I mean?
Yeah, well, we do our budget every year, and this time we kick it off in like January, February,
Yeah.
and it goes back and forth. It's due from our departments have our budgets due in April,
Right.
and then we go back and forth. But they have definitely mentioned that they don't know where they stand with the state, so that's definitely a concern because I know the state funding is projected to be down.
Big time.
Yeah, and city funding is too. So, we do our best to make up the shortfalls, but it's definitely a challenge.
Like you, we start our budget, the state starts their budget process in January, but we didn't finish our public hearing. So I'm hearing rumors that the state will not have a formal budget, which starts in July until October. So it should be interesting.
That's usually how the state goes, though, isn't it?
We're never that late. We might be like a few weeks late, but we're never a month late. So it should be interesting this year.
Well, I believe the mayor said that he has to submit a balanced budget. He can't run a deficit.
Yeah, neither can we, which means it's going to be layoffs.
The mayor has said at this point no layoffs are on the table
No,
for the employees.
I didn't mean for the city. I meant for the
No,
state.
I know. Just saying that as an update. So anyway, it's definitely a challenging time economically, but with restaurants reopening, hopefully the city will be getting some tax revenue as people start to go out and about again. So we look forward to that. And then one other note related to this topic is the mayor created a health inequities task force shortly after the coronavirus hit our city. And as part of this task force, they're really looking at health disparities of people of color, of people with different races, different ethnicities, because as we know, they've been impacted more significantly than people from more affluent neighborhoods and people of different white background, basically, to be honest. So we're looking at at all those things. They're looking at data. They're looking at providing different services they can do to impact the outcomes of health outcomes of people of color. And after many weeks of advocacy, the mayor agreed to appoint a representative from the disability community to the Health Inequities Task Force. So he appointed Dr. Sherry Blauett from Spalding, and many of you may know her, but she's going to be a great advocate for our community on the Health Inequities Task Force.
That's great.
So glad to hear about that. A few other updates just on the city and our department. All our staff are still currently working from home. We don't have any information yet as to when we'll be back in the office. City Hall is open to the public. It's been open to the public from day one, but right now it's only open a few days a week, and it's only by appointment. So if you need to get a birth certificate or if you need to pay a parking ticket, we suggest that you call ahead or go online or send us an email, because right now it's appointment only, and there are a lot of precautions that they're taking before they let people in the building. So definitely let us know, and let your networks know. If you're talking to your friends or colleagues, let them know that before they come into City Hall, they should check in on the schedule and just make sure that they make an appointment with the department they need to see. And then my final update on the city is a fun little note. Do you remember last year when I told everyone that there was a famous movie director, producer who was making a film on Boston City Hall? He actually came to one of our board meetings. I think it was October of last year, and he filmed board meeting.
They filmed it.
Yep, he filmed it, and the movie is now complete. And I got a link to a sneak preview. It hasn't been released yet, but we are featured in the movie. There are 4 minutes of our advisory board meeting.
Oh, gee.
Jerry, unfortunately, you're not there, and Kyle, you weren't there. But Elizabeth, Carl, Ducia, Juan Carlos, Wesley, I didn't see Zari, I saw Yardley, I saw Paul. Everybody, most people were in it, and it was really good. We were talking about master plans with the Boston Common.
Are you allowed to share that link?
I can't share the link yet because it's not public. But Carl, I will say you had a starring role in the film, because I talked about the Boston Common master plan and the steps leading up to the Shaw Memorial. So you said that you jumped in and said that, oh, you get complaints about that at the State House, and that you'd be happy to work with me moving forward. So there's a nice close-up of you and some nice comments.
Hollywood's calling for Carl.
Yeah, he's a famous doctor. I can't remember his name right now, but he's a very famous documentarian, and I studied him 30 years ago when I was in film school. So he's been around a very long time.
Yeah, his name's Fred Wiseman.
Yeah, that's right. And he's done documentaries on mental health institutions and a lot of bureaucracy, high schools and things like that.
So the movie, you'll have to prepare yourself when you go to watch it, because it's 4.5 hours long.
That's the way all his films are. That's the way all his films are.
So I only got through the first maybe 2 hours so far, but I'm watching it in increments. So we could be in it some more, I don't know yet, but it's a fun little fact. So he's next sending it out to film festivals, and then it will be released to the public. So maybe we'll win an award. All right, so some updates on City Hall Plaza. After the last board meeting, we held a meeting just with the board members. Many of you attended. Thank you very much for that. And, I'm sorry, Elizabeth, I meant to mention you were in the film too. You were sitting right next to me. I think I left you out. So anyway, at the meeting that we had, thank you all for attending. We went over the accessibility plans in more detail, leaving the brick aside for a few moments just so we could focus on the other access elements. And I really appreciate all your willingness to trust in, my recommendation and the city's commitment to making an accessible new plaza. So after the board meeting, we had a meeting with Chief Brophy, who's the mayor's chief of staff, the chief of operations for the city. And it was 2 members of the board and 2 community advocates. It was Jerry and Elizabeth from the board, and then Michael Mewey and Carol Steinberg from the community. So we had a very in-depth, robust conversation with Chief Brophy. He was very amenable to input and to to working with us throughout the project. I have a list of the things that he committed to, which include a solid installation, specifically paying attention to detail in the way the brick is laying, and the clerk who's appointed to the job is a very knowledgeable clerk when it comes to masonry. So it'll be a really good installation. He committed to having the board come out for site visits during construction. He said 3 months, 6 months, 9 months, whatever we want to come out. He'll make an accessible path. He'll let us right in. So that was really good to hear. He also agreed to a site visit after it's been completed and used for 1 year. He agreed to a maintenance plan. Thorough, regular maintenance will take place. He committed to regular snow removal because it will be so even now. The grade and the bricks will be nice and smooth. They'll be able to use things like snow blowers and small bobcats, whereas right now they can't use anything like that on the plaza. A lot of it they do by hand, which is why the snow removal can be so bad. He also agreed to set aside funding for replacement or removal of the brick if it doesn't hold up. And he agreed to a written agreement to codify all these commitments. So, go ahead.
Oh, I'm sorry, Commissioner. I know your hope was maybe to have at least a draft letter ready. I assume it's not ready yet for us?
No, it's not. I was a little too ambitious because I think we just had the meeting last Friday.
Yeah, we did, yeah.
But no, we've just been so busy with other things. I haven't gotten to that yet. But I will commit to having it for next month.
Okay, great.
So I'm going to work with the public facilities. That was Maureen, who was involved in the presentation at last month's board meeting. So Jerry or Elizabeth, do you have anything to add about that meeting?
Go ahead, Elizabeth.
Yes, we thought it was a very positive meeting, and certainly we were very encouraged to hear that to hear Chief Brophy discuss the importance of this project, that the mayor views it as a legacy project from his administration. That we did, though, want to make sure by the end of that meeting that we did have the verbal commitment from Chief Brophy, which he gave us. As part of it, I see Kyle's not currently, the video of Kyle isn't there, but I not only wanted to thank Kyle for keeping it moving forward. Kyle, I was just saying, we were talking about the plaza redesign, but also Carl, your input, and John Winsky's about saying it looked like, despite our concerns and the commissioner's concern about brick, that was a decision that was going to stand, but that we not only discussed the importance of maintenance, but we also, as part of this written commitment that will be forthcoming from Chief Brophy, is that we requested what's called a post-occupancy evaluation, a formal comprehensive evaluation, because although brick was a significant concern of ours for people with mobility issues and the low vision and blind community, but that we also want to make sure that all aspects of the design are working to make it truly accessible, and that if certain things aren't working, within 12 months of the completion of the project, that we would have the opportunity to have this formal evaluation to see in all parameters how it's working. Obviously, if there are some issues that arise even prior to a full year that need immediate addressing, they would be, but this would be a chance to have something that's a recognized type of post-design reassessment included, along with some set-aside money. Commissioner, I did have a related follow-up question. You had helped me better understand that this particular redesign project, although it will include a vast majority of the project, there is the south portion, as I understand it, will not be part of this phase. And that also, am I right in remembering that this phase, encompassing most of the plaza, is a 3-year project. Is that a correct understanding?
It is. I'm just not sure if it's the south section, but I know, because I'm not good with directions, but I know there is a chunk of the plaza that's not included in this. And if Sarah, Patricia, Jessica, if you know which section it is, the name of it, please type it into the chat. But it's the area where we have the access path right now, going towards Washington Mall, that will still remain in place. So that area will not be part of this first renovation. That will be under a phase 2, and it is a multi-year project. So yes, that won't happen for a few years, but phase 2 is an even bigger project because that's going to involve, it actually might be phase 3, but they're working also on the building. So one thing that I'm really excited about, which I've been pushing for, begging, pleading, and threatening, since I was appointed 10 years ago, is access from Congress Street right up to City Hall Plaza. I want an elevator, a elevator that goes from Congress Street right up to the plaza. Because all day long, I see people come to Daniel Hall, look at the stairs, and turn and just walk away. Because if you have any type of mobility impairment, or even if you're just older, or you have little kids, or you're tired, it's an insurmountable amount of stairs. So the city has it in its master plan to put an elevator to make that connection. So I'm really excited about that. I think that is in phase 2 because that's the north plaza. So Trisha just put in the chat that the north part is the part that they're doing. So I'm assuming the other part is. So you are correct, Elizabeth, that won't be part.
Commissioner, it's a little hard to hear you. You're fading in and out a little bit.
Okay. Sorry about that.
That's okay.
Does that answer your question?
Yes, it answers that part of the question. But I think given the level of concern we collectively were expressing, that we just have to realize that there will be portions that will not meet this improved standard for some block of years. And I just want to reiterate the importance on our part of continuing, as positive a meeting as it was, to continue our advocacy and vigilance, if you will, because the chief also described it as a beautification project as well as an accessibility project. And certainly making the plaza not only more aesthetically pleasing, but more user-friendly for all people, even the people who don't have accessibility needs, but having it be a gathering spot is important, but that just to make sure that with the people who are interested in maintaining history or aesthetics, that they're not viewed as equivalent to accessibility. But I know, Commissioner, you've certainly been trying to keep that, as an important component.
And I think what we can do is we can definitely involve the board in the next phase when they're working on the. I know they have designs for that, but I don't know what phase they're in, if they're completed or not. But we'll have you in earlier on the process so you can see what's going to happen on the south side of the plaza.
That would be appreciated, because I think one of the lessons that we learned from this is that maybe we as a board were involved a little late or didn't pay attention initially. So, and I know your office has committed, Commissioner, to maybe highlight more some public meetings that you think we should have more on our radar, and make sure we have attendance at, things like that. So
Definitely.
we appreciate that.
That's been another one of my goals for a long time, to really get the word out to you about projects that you could have an impact on. My staff does a great job, but it really helps when they hear from the community as well. So we will work. And any other questions about City Hall Plaza?
Yeah, does anybody from the board have any questions? Basically, just to piggyback on what Elizabeth and the commissioner said, I thought the meeting with Chief Brophy was great. Initially, we were only slotted for like 15 minutes of his time. He ended up being with us for a good 45 minutes. And again, he really did reiterate that he wants the plaza to be accessible for all, and that he wants to make sure that it's right, and to have us involved with every phase of the project and of the initial phase, to definitely have us, like the commissioner said and like Elizabeth said, to have us out there, to have us check the brick out, to bring up any concerns that we have at that time during our site visits. But he also, like Elizabeth said, he committed to having the review of the project after a year. And again, he said that, you know, he would set aside some money for needed, you know, improvements as well. So I thought the meeting went very, very well. And I you know, I want to thank the commissioner and her staff for making sure that again, accessibility is at the forefront of the project.
So yeah, Jerry, on that note, I will send out some possible dates and times in the next week or two if people want to do site visits to see the part of brick by the MBTA station. And we, like I said, we can do it 2 or 3 people at a time and just social distance. So look forward to that.
Sure, that might be a good idea. I didn't even think we would do that, you know, very soon. But again, if it's only 1 or 2 of us at a time, I think everybody would be socially distant. So
Great. So then, not to keep people much longer, just a couple of quick updates. On the note of architectural access, there are 2 projects that I wanted to mention. The Northern Ave Bridge is being designed, and that's kind of on a fast track. It's kind of on a fast track for design and starting the build. So Patricia has been very involved in that, fighting for access.
I'm sorry, Commissioner, there was a phone in the background or something. Could you repeat what the project is?
Yep, it's the Northern Ave Bridge.
Okay.
They're redesigning it, and Patricia's been advocating for increased accessibility. So one thing we were able to get, we'll send you a link to the plans because they're really beautiful. But we were able to get accessibility on both sides of the bridge to the lower level. There's a lower level that's going to be seating and like open space with benches. And originally the design had a ramp on one end, stairs on the other end, so you have to move all the way around. But Patricia worked with the group to design a really beautiful ramp for the other end that's part of the stadium seating. So it's a very long switchback ramp, but at least it will be accessible on both ends. So we will email out that design. It's definitely worth reviewing. And then the other architectural access project I wanted to mention was Mobley Park in South Boston. This is a large investment money. They had a public forum today, and we're going to do a link if you'd like to watch it. And this is a good example of the type of forums that we can send you on projects that you may be interested in. And I believe that's still good. So we'll send you those links. And then just 2 other quick updates. This coming weekend, is the Virtual Abilities Expo. It's going to be from July 9th. Oh no, is it July or June? It's July. I know to say July, but I think
It's 3 days, it's this weekend.
this weekend, okay. Sorry, my notes say July, but I think it's June. So we'll send you that link. It says it's available 24 hours per day for all 3 days. So log on if you have time. And then finally, the city's making a real push for people to do the census. If you haven't completed the federal census yet, please try to make an effort to log on and complete it, because that really helps the city get funding, federal funding for programs and services. And it's just really important that we have an accurate count. So we want to make sure you're all counted, so please make an effort to complete the census and talk to everybody you know and make sure they complete it too. So those are all my updates. Any final questions or comments?
Yeah, any comments, Patricia, on anything, or?
No, I'm all set. Thank you very much. You did a great job, Commissioner, encouraging the board to take a look at those videos, the video for the bridge and the video for Moakley Park. Thank
So
you, Jack.
You'll send those out, Commissioner?
Yep, I think Jessica's working on it.
Great.
There's an email, Jerry, there's an email that I will hit send on once this meeting is done with all of the links.
Okay, great, thank you. Any other questions or comments from the board? And I know what Carl wants to do, but any?
No, I'm not ready to adjourn, actually.
Okay, so any comments or any questions from the board on anything that the commissioner said? Anything?
No,
sir?
no comment.
No
Anything,
comment.
Carl?
Do we have any new, are we on to new business or old business?
Yes, we're under, we moved under new business, sure.
So I just wanted to make people aware, one of the issues that the House and Senate at the State House are voting by mail because of the pandemic. And there are many people, particularly those in the blindness community, who have concerns that they will not be able to vote by mail and it will not be accessible. And it'll also be more challenging for them to go to the polling stations, because one of the reasons why they want to do vote by mail is because they want to close down a number of polling stations to limit the exposure to the virus. So I have been working with the various disability communities and the legislature and help the Senate write an amendment to ensure that the vote by mail process will be accessible. And that passed yesterday, and the House voted on their version last week and it passed. So now we're waiting to have the two bills come together and concur, but hopefully very soon we'll have legislation that will allow for accessible vote by mail. So keep your eyes, and I'll send links and information to the commission so that they're aware of what's going on.
Great, how can we support that, Carl?
Well, right now, you can, I'll send you some language so that right now what you want to do is let the speaker know to concur with the Senate version, but I can send something out tomorrow or Friday and let you guys. Yep.
Carl,
Great.
what are the issues that make it inaccessible for people who are blind at voting?
What if you got what if you got a print thing in the mail? How would you fill it out?
So they're not going to do Braille?
Well, it's not just Braille. I mean, most, and the percentage of Braille, no. So one, you wouldn't be able to access it or read it. Two, how do you do it privately and independently if you have to ask a caregiver or a friend?
Yeah.
And so basically and two, how do you sign it, right? Because there's a couple of potential solutions. And by the way, there have been lawsuits and injunctions over the whole entire, New York, Pennsylvania, Colorado, California. The blindness community has been extremely active in this area. And so far the courts are backing up the blindness community. There's a couple of things. Many states are still afraid to allow you to vote electronically because of security reasons. So what we're suggesting is, all right, fine, but allow us to go online and fill out a form and print it out, and then stick it in the
Right.
mail.
Okay.
Or on the ballot, have a couple of bumps or holes between where you want the signature to be, so I can sign it. You know, there are things you can do so that we can still maintain, because basically the state, and all the elections are state run, they're not federally run, they're state run. The states are still gonna wanna see paper ballots as backup, right? So they're never gonna go paperless, not in these times. So we're trying to find compromises that work both for the blindness community, but also maintain security concerns. And one of the things we're suggesting is that you at least give us a way to print out the form electronically so that we can print it out.
Yeah.
But we print it out independently, securely, and privately ourselves so that we do it. And then we can stick it in the mail and mail it.
Right, because another thing I just thought of, just talking it through, is I'm sure you know, everybody who's blind doesn't know Braille, so that's.
Right, yeah, and the other thing is, let's just pretend I could get to my polling station. How do I get to the machine without doing sighted guide and grabbing onto somebody's elbow? Then once I get to the machine, I'm gonna put on these headphones that every other person who required the accessible voting machine has used. And I'm gonna be touching the monitors and the buttons and the screens, and so there are just some health concerns also, even if we can get to this polling station and use the machines.
Well, great, thanks for that heads up. We'll look forward to
So
the.
I will send out some language, probably on Friday.
Great, thank you.
Yeah, thank you.
Any other new business or any other questions or concerns from the advisory board?
Jerry, can
No.
Yes,
This isn't related to the meeting, but Jessica, can I just ask you a technical question once the meeting ends? Just a video interface question after the meeting.
and Kyle, did you have something?
No,
No.
I am ready to make that motion now, Jerry.
Okay, great. Do we have a motion to adjourn?
I make a motion to adjourn.
Any second?
Second.
All in favor?
Aye.
Hi.
Great, the motion carries. Thanks, everybody.
Thank you.
take care, everyone.
Thank you, everyone.
Have a good night. Stay well.